Hello, my podiatry patients. Hopefully, you're not quarantined to your house. Hopefully, you're not limited what you're able to do right now. But if you are, that's okay. That's part of the reason I'm doing this. So what I'd like to talk to you about today is one of the more common things that we see. It's called plantar fasciitis. If you do an internet search, you're going to see multiple things that are talking about heel pain and the way that it's going to present, and it's always called plantar fasciitis. But let me give you a little bit of background first, okay? First things first, you have your heel, you have the Achilles tendon that attaches on the back, you have a ligament called the plantar fascia that attaches on the bottom. So when you walk or run or anything like that, the Achilles tendon is pulling one direction, plantar fascia is pulling the other. The weaker of the two, of course, the ligament, starts to pull from that heel and it starts to get inflamed, painful, and tender. And it becomes a plantar fasciitis. So how does that present? Typically it's significant heel pain or pain right at the beginning of the arch, right where the arch attaches to that heel. It can be pretty significant. It can be a really sharp pain right in the center of the heel. It can be a dull pain. Typically it's worse first thing in the morning or after sitting for a period of time. That's called post-static dyskinesia, where you have pain after sitting or after limiting motion. And the reason for that is when you lie down at night or when you sit down, your foot relaxes, the plantar fascia tries to heal, and when you step back up, you're starting to tear it again. So a lot of times people will say, well, one of the things that I do is I'll throw a little towel over my toes and stretch them out a little bit. That makes it so it hurts less right when I get up. Those are the typical symptoms of plantar fasciitis, although some individuals have pain that gets worse throughout the day, and that can also be a less common form of plantar fasciitis or inflammation of that ligament, the plantar fascia. So what's the cause? What really causes plantar fasciitis? The most common cause is a tight Achilles tendon. A lot of us don't stretch like we should. And if you wear a shoe that has a little bit of a heel, even just a slight lift, which is most women's shoes, you're going to have an Achilles tendon that will slightly shorten to give you additional support in that position. And so you have a little bit more limited motion of your ankle, which causes a little bit more stress on the plantar fascia or creates a plantar fasciitis. Most individuals, when they start to get the plantar fasciitis, will be looking for different things that they can do at home, and we will talk about that tomorrow. But to give you the background that you will need today to help you with your plantar fasciitis is there's usually two different things that need to happen. Number one, you need to get control of the inflammation that's causing the pain. Plantar fasciitis hurts because it's inflamed. If you get rid of the inflammation, the pain goes away. And then the second thing that you need to do is you need to find out what's causing it. And so as you treat the symptoms and get rid of the inflammation that's causing the pain, then you can focus on what caused it so you can actually make it go away and hopefully never come back. So do you have heel pain? Does it hurt first thing in the morning? It's usually plantar fasciitis. So if you were to go to the doctor, what should they do to help you decide what you're going to do for treatments, which again will be our discussion tomorrow. Number one, they should do an evaluation of where the pain is. The pain should be localized to right where the arch starts or the center of the heel or a combination of both. Typically, you aren't going to have pain that's going up into the ankle, although you can get a mild Achilles tendonitis if you change the way you walked over a period of time because the heel was hurting. The second thing is they should do imaging. The most common is doing an x-ray to make sure you don't have a stress fracture or cyst or other problem that could be causing this pain in the bone itself, and an ultrasound where you can actually physically look at the plantar fascia and see if it's inflamed. The usual ultrasound imaging should be about 20 millimeters on ultrasound. Most individuals are going to have 40 to the highest I've seen is about 110 as far as the inflammation that you're seeing in that plantar fascia. So as you do those things, you have a confirmation that you have a plantar fasciitis. If they are looking at your heel and saying, well, because you have heel pain, that's got to be plantar fasciitis, they're not giving you the best options or the best diagnosis to confirm that that really is your problem. The problem with that is some of the treatments for plantar fasciitis can make a bone cyst or a stress fracture worse. So you do want to get the full diagnosis if you are to be seen for plantar fasciitis. This is Dr. Brandt Gibson, and that is your podiatry tip for day number 1.